Welcome to the World Explained. More and more products use the speech recognition function. Nowadays, it is not only possible to recognize voices, but also to assign them to the respective person. What is celebrated as a small revolution in the world of technology is quite normal for our brain. But which brain areas are responsible for speech recognition in humans? Studies of patients with brain injuries show that our personal assistant for speech recognition is located in a coil in the right temporal lobe. As humans, we are constantly in situations where we talk to others, whether on the phone or face to face. In doing so, we not only recognize what someone is saying to us, but also who is speaking to us. This is important, among other things, to distinguish friends from strangers. The voice of our conversation partner helps us to do this. Researchers have therefore long suspected that there must be a center for speech recognition in our brain, just as we have a special area for face recognition. But until now, scientists have not been able to agree on exactly where in the brain the areas are located through which we recognize a voice. Today we know that the right temporal lobe is crucial. Very reliable statements about which areas of the brain have which functions can be made on the basis of studies of patients with brain injuries. If a certain area of the brain is injured and a certain ability fails as a result, both can be assigned to each other. Patients with brain damage, especially those who have suffered a stroke, are examined for their ability to learn voices and then recognize them. In the recognition test, patients assign either names or faces to the known voices. For a better qualitative result, brain scans of the patients, which show their brain structures and the damage in high resolution, can be used for comparison. It is shown, if the brain in the right lower parietal lobe is damaged, there are clear problems in assigning the voices to faces. However, if a certain area in the right posterior temporal lobe is damaged, the voices are not recognized at all, and cannot be assigned to a name. This explains why previous studies yielded contradictory results. The region in the parietal lobe is closely related to facial recognition. However, the actual processing of known and unknown voices takes place in the superior temporal gyrus. Another phenomenon is also known in this context. It is colloquially also known as voice blindness. The inability to recognize voices. Even though there are only a few affected people worldwide, voice blindness is a great curse. They do not succeed in recognizing other people by their voice, not even their own mother or children. Damage to the right temporal lobe also plays a decisive role here. In comparison to patients with brain injuries, however, it is not the failure of brain structures that is the cause, but the deviating activity in these areas. These findings help us to better understand how the brain recognizes voices. This is the basis for effective therapies for patients with voice blindness, which in some cases is congenital, but is quite common especially after a stroke. Nevertheless, the phenomenon is still hardly known in the medical field. Thank you for watching The World Explained, and I'll see you in the next video. So make sure to subscribe and have a wonderful day.